Evening, and our second topic is healthy travel, and we have Dr. Dr.sheef, who's a consultant of internal medicine, thrombolism and vascular medicine from the Department of Medicine with us. Welcome back once again, Doctor.
Yes, nice to meet you.
Thank you very much for being with us. So Doctor, we only have a very short time, I'm afraid, but we'll try to get through as much important facts as possible on what we should and shouldn't be doing when we are going abroad and when we're traveling. If you could tell us some of the main things that we should do.
Yes, I think this talk is important at this time because this is, the vacation time and people are preparing, packing their bags for travel. I think health problems during traveling is really important. Factor either will make the trip enjoying or make it, less enjoying. And this is there is important concept called travel medicine. This is sub-specialty of internal medicine or infectious disease, highly specialized field, where you see travelers ahead of time, like ideally 4 to 6 weeks before travel, to give them medical advice, and again for providing or provision of immunizations, because you might travel to some endemic areas like yellow fever. You need to be vaccinated. Also, they provide some medications to prevent malaria, because there are malaria, it's endemic in some parts of the world like Africa.
Sure.
In addition that, to discuss or to evaluate the baseline health before travel. Maybe the patient having or traveler already a patient having chronic medical problems. You will ask me where to find such clinics. Really not existing in our country. Only one clinic, specialized travel medicine clinic in Medina Al Munawwara. Ideally should be all regions of the kingdom specialized travel clinics. And this is important because I'm trying planning for traveling. What shall I do if I don't there is no specialized travel medicine clinic? So there are important sources of information. Number one, that's the most important, it's only in English. This is the problem, is the CDC, Center of Disease Control. This is a website in the States. What you do, you just Google for it, search in the Google engine, and you will find it. Then you go to the main website and you search which country. For example, I'm planning to travel to Tanzania. This is very important because in the clinical practice we are seeing patients coming with complications or medical problems when they return from their trip. I think this is important to emphasize that prevention is better than cure, or one stitch in time is better than 9. So just enter, for example, Tanzania, then we'll tell you, this country is endemic for malaria. There's yellow fever, there's typhoid fever, there is hepatitis A, outbreak there. So what you need to do, you need to take chemoprophylaxis. This is pills, to prevent malaria 4 weeks before and during the trip and after. You need to take some vaccination for yellow fever. In addition, you need to follow the safety precautions. This is important regarding food and water, because it will tell you this area of the world is highly high risk for traveler diarrhea or food poisoning, because the sanitation or the hygiene there is low standards.
Sure.
So if you go, so you have roadmap, what you will do, so you can avoid or prevent all health related travel related health problems.
Definitely. But Doctor, as you mentioned, travel is diarrhea. That's something that happens to a large percentage of travelers.
Yes.
And talking about the hygiene in countries, it's not always your fault as a person, that even when you go abroad to a country, and obviously you have to know if the water is drinkable or not drinkable.
Definitely, yes.
But apart from that, I agree with you totally about getting immunized and seeing your doctor in advance, especially if you're going somewhere you haven't been before, somewhere different that is tropical, or
countries, yes.
Countries like that.
Yes, in Saudi Arabia, we are really fanatic of traveling to Africa for hunting, for, we call it adventure travel. So this is not something theoretical. We are seeing, on daily basis, returners from, endemic areas with serious infections sometimes. So traveler diarrhea is not, it's differ from one country to the other, because WHO, World Health Organization, classifying the regions or the country three regions: low risk for traveler diarrhea, intermediate, and high risk. The high risk, like regions or countries, Southeast Asia, except Japan, and also Central America, Mexico, and also Africa. So this is very high risk. Then you have intermediate risk, like this is the Mediterranean, sea cities like Lebanon, Syria, and Palestine, and this area we call it average, or intermediate. Then you have the low risk like Europe, States, Canada, Australia, and New Zealand. So when we say low risk, it means less than 10%. When we say high risk, it is more than 30%. So some people say, oh, when I go to this country, like they will stamp my passport, the stamp to getting, watery diarrhea. It's just, that's why you can avoid it, even if you are traveling to such area. So we have to go back to define traveler diarrhea. Is it any, passing loose bowel motion, this is diarrhea, or traveler diarrhea? Is not, because you can have sometimes just changing of the climate, stress, change of the time zones, the jet lag. You might have some diarrhea or nausea, vomiting that will settle within one day. But to say traveler diarrhea, you have to meet some criteria, that you have passage of watery diarrhea or bowel motion 3 times, more than 3 times within 24 hours, within a day, and also associated with other symptoms like nausea, vomiting, abdominal pain, crampy abdominal pain, and they can have low-grade fever. So this is traveler diarrhea. It is self-limiting disease, i.e. it does not need, curative treatment, just needs supportive treatment with rest.
Does age matter, for example?
Yes, that's a very important question that will come to that, because there are some categories or age groups at higher risk than others, because extremes of age, infant, pediatrics, and elderly, more than 65, these people are susceptible, or vulnerable to more complications, like they might have, dehydration. This is the complication of diarrhea.
Actually, doctor, I don't want to cut you off, because it's very, very important, of course, to talk about this. But we have to go for a short report, after which we will be back to continue talking with Dr. Mohammed Al-Sheef about healthy travel. So stay tuned.
How to prevent seasickness. Being sick at home is hard. Being sick on a boat is unbearable. Keep seasickness from ruining your vacation. You will need motion sickness medication, water, bread and other grains, apples, bananas, hard candy, and dry crackers. Step 1. Think preventively. Take an over-the-counter antihistamine 1/2 hour prior to boarding the boat or at the first signs of seasickness. You can also consult your doctor for prescription medication. Step 2. Drink plenty of water prior to boarding. Dehydration can make you dizzy and cause nausea. Avoid drinking alcohol, which can cause dehydration and nausea. Step 3. Eat right before heading out. Bread and other grains, apples and bananas are all good choices. Avoid anything greasy or acidic. Step 4. Find a spot on board where motion is least noticeable, such as the inner middle part of the boat. A window can help put the rocking motion into perspective, but can also worsen the feelings of nausea as more objects are moving. Step 5. Focus on the horizon and scenery rather than the water or the movement of the boat. If you feel queasy, stand, Sitting or lying down can increase nausea. Step 6. Suck on hard candy or eat dry crackers to keep nausea in check. Did you know? Some people who take long cruises suffer land sickness for a few days after their trip as their body readjusts to being on firm ground.
Welcome back, of course, dear viewers, to Harmony of Life. Back, of course, to this, let me say, very interesting, as always, of course, topics, healthy travel. You gave us, of course, a couple of good pointers, first of all, regarding traveling diarrhea. Also, when it comes into medicine, what to do when you're abroad. Let me ask you regarding also, of course, transportation while traveling. Others may use cars, some may use, for example, of course, and mostly airplanes, and some, just love the sea, may cruise, may actually, exactly as you mentioned, cruise the ocean, kind of a nice honeymoon style. But then he figures that the wife is seasick. In this case, what am I supposed to do?
Yes, definitely. So there are each, mode of transportation has its own health risks. Regarding, traveling with the plane, that, important, health problems, I will just go quickly over them, like jet lag. This is important, jet lag. This is physiological, disturbance in the biological clock, because when you travel across several time zones from east, from west to east, or from west to east, you might have, disturbance of the biological clock. Like I'm traveling from Saudi Arabia to Malaysia, and the difference time is 8 hours. So I will, after I arrive the destination, I will reset my watch. But what about your brain watch, biological clock? You need to be reset. You need like 1-2 days that you have symptoms of jet lag, mainly, the difficulty to fall asleep, insomnia.
No, your sleeping patterns are disturbed.
Yeah, disturbed because it's reverse, pattern of sleeping. The day will be night and the night will be day. So it will be difficulty of sleeping, headache, fatigue.
So what is the best advice, doctor, when you are traveling
yes, definitely.
from these different time zones? How can you best prepare yourself to feel better as soon as possible?
Yes, there is medicinal and non-medicinal or behavioral, okay? So behavioral, what I do, so I will, in the area, in the departure, country of departure, so I will reset my watch. Before I arrive to the destination, I'm assuming myself I'm in the destination. So I will try to cope or adjust my sleep pattern according to the destination. It does work, this technique, in addition to some people who experience bad jet lag, okay? Very bad jet lag. They can take some medicines. There are, hormone given through injections, melatonin. Melatonin, it's secreted from the pineal gland, from the brain. This hormone increase with darkness and decrease with light. So they can be given, or there is some medication, Zolpidem. Other problem related to travel, the airplane, the ear and sinus problems. Especially if you have already, upper respiratory infection like blocked nostrils or congested nostrils. There is important, canal called Eustachian, canal. This is the guy who, discovered this. This is connection between the inner middle ear and, the nasopharynx. This equalizes pressure between the, if you fly, high altitude, there will be decreased pressure, so there will be pressure over the eardrum, and you'll have pain. You might have difficulty hearing, you might have tinnitus, feeling, and sometimes severe. What do you do? So if you have this, upper respiratory infection, blocked nostrils, or so you have to take some medication, decongestant, to relieve the congestion. It's the antihistamine, or the other medication. There are, either drops given through the nose or the pills. In addition to chew gum, and if there's a baby, to breastfeed or bottle
if you
feeding.
have an infant, coming back to Waleed's question before about how important is age of the traveler, to different illnesses that can happen. Now, if you have infants and young children on planes, they often have the same problem you're talking about with the ears. And,
yeah, that's why when you notice during takeoff and during landing, you see the kids crying. That's why it's good to feed them, breastfeed or bottle feed, so it will equalize the pressure. That's important. In addition, there are some people who have chronic medical illnesses. They have cardiac disease, or you have we call it emphysema, COPD, chronic obstructive pulmonary disease. They already have hypoxia, low oxygen level. And when they travel through airplane, they might require supplemental or additional oxygen. This is important. Back to your question about if you travel through boat or ship or cruise, and myself, I experience severe motion sickness. So there is medication. It's antihistamine beta-circ. It's well known. Physician, you can ask your. That's why you have to plan your travel and to meet your physician. Beta-circ, it will really effective to relieve the motion sickness. That's important.
Of course. Let me say, speaking again regarding people who already have, for example, diabetes or heart issues, for example, and then when they actually jump into the, of course, plane or boat, or even by car, actually. I mean, I think traveling for long hours is always an issue. And tell me if this is a factor or not. Is, for example, traveling for 8 hours, could it also put you in the risk into getting a heart stroke or heart attack? Is that a fact?
That's very excellent question. So people who have chronic medical illnesses like diabetes, hypertension, high cholesterol and others, it's important before they travel, visit their healthcare provider to discuss with them, first to refill their medications. Important, they have to have adequate supply, because they might run out they might run out medication in the destination country, and many times we don't have alternative or similar medication, only in the country of departure. That's important. You have to supply enough supply, and you carry it with handbag, not to put it in the luggage or baggage, because sometimes you lose it or it will be stolen. That's very important, or might be damaged because of the the temperature issue. So that's important. And these patients, in addition to like pregnant, they might be at risk of developing, blood clot. It's not the blood clot that it's a venous, in the vein, in the lower, limb veins. Because what happened?
Deep vein thrombosis.
Deep vein thrombosis, yes. So deep vein thrombosis, and the counterpart of it is the pulmonary embolism. They are like two sides of the same coin. So when you travel long trip, more than 8 hours, you are at risk to develop blood clot, especially if it's pregnant, late pregnancy, stage, twin pregnancy, his family history of blood clot, or other, additional, like venous thromboembolism risk factor, like taking oral contraceptive pills, and there are many risk factors just for the sake of time. So they need to put preventive measures, like to put on elastic compression stockings, and to to drink a lot of water, and to move around and exercise the legs. That's important, to prevent the deep vein thrombosis. And it's interesting that people, they study this, whether there is, influence of business class versus, economy, and they found more with economy. Sorry, with business class than economy. And we thought, oh, wow, it is more spacious. Why? I think people with, business class, they really, stay. But in the economy, it's the place is, it's tight, so you have to move around to stretch your legs. So not any patient, like usually chronic diabetes, hypertension per se or alone is not risk factor for blood clot in the deep veins or deep vein thrombosis.
What about an older person, doctor? Apart from pregnant women, what about old people, say 60s and above? Even if they
Definitely.
don't have other medical complications,
Definitely.
what is it like for them? Can they develop?
By the way, we don't want to go and usually when we say this is risk factor for blood clot, we classify to major and minor. This is minor risk factor, and it increased the risk twofold. Okay, so it means alone it will not cause unless you have other, risk factors. Okay, like trauma, you are putting cast, we call it plaster cast, immobilization. So this is all together. That's why we calculate risk or to develop blood clot in order to give medication. Sometimes a really highly educated patient, they will come to you, oh, I want to put every measure to prevent a blood clot, and we go with pharmacological, drugs like heparin, injectable heparin 2 hours before the trip.
Exactly, and I think these, of course, very valuable information that you're giving us, Dr. Sheef, are all definitely, of course, great information. I think it was covered actually greatly and briefly, of course, in these last, let me say, 20 minutes that we got. But I would like to thank you personally, of course. I think it was definitely, of course, a very great topic. And speaking about traveling, actually, we could go on forth and forth with you. It will take me 2-3 hours at least for us to continue. But thank you so much, and it was a pleasure. Thank you.
Thank you.
Allow me, of course, also to thank my, of course, also special colleague, Camille. Thank you so much. I enjoyed, of course, my second day here with you. Hopefully, tomorrow, of course, tomorrow actually will be my last day, of course. After that, our colleague Azhari will be back. But a special thank, of course, to you, the viewers, also, and all to the, say, very active, also casting team here, led by the director here today, Mohammed Arrar, and of course the cameramen in general, Bandal Ataybi, and of course Abdul Khatran. All these guys, thank you so much. Have a great, of course, day. We'll see you again, inshallah, tomorrow. Take care.